morning, friends. Good morning, friends. Is it just me, or it's kind of nice watching someone else do some tasks? Like making the bed. That's why I gave like a little montage of changing my bed this morning, because sometimes I just feel like it's nice when it's not our own to-do list, which is probably 50 items long. But today's going to be a little 2-for-1 special. Today I am going to share some crazy news that I still have a hard time believing, so therefore I know you almost won't believe it. Yes? Son of a nutcracker. Can I help you?
You're running out of battery, I can tell. Okay?
Mm-hmm.
You're live.
Okay, we're moving just to move in front of the window a little better. Okay, so literally, I still think it's crazy, but at the same time, there's also a question mark in this information. So yeah, there's a lot to share, but I'm gonna get ready while chit-chatting with you. So 2-for-1 special is I'm sharing the news with you about our genetics results, and I'm gonna do a little get ready with me. But I start with putting my mascara underneath my arm, and I'm gonna try doing my little brow, whatever it's called, under my arm too. So I'm not specifically doing this video to show you products that I use, but all my makeup is Beauty Counter, and I share with you guys about them on occasion, just because for anyone who's interested. I usually share when there's like a sale going on, and I know they've got a lot of like good holiday deals and things like that, but I'm not actively sharing them all the time. I kind of hate that they are an MLM, but I love that it is a beauty line that is clean. And so then I feel more comfortable putting it on my body. And so if that's something other people are trying to clean up their products, I feel like this is such a great way to start, because the products actually work and they're clean, versus my girlfriend makes a joke. She's like, it's not like rubbing beet powder on your face, which is just so funny because it's super clean, yeah, but it falls off your face by the end of the day. So anyhow, I mean, I can kind of show you what I'm using at the time. This product is discontinued, so you can't get this eyeshadow anymore, but I'll just start with putting on some eyeshadow. Okay, let's start with what in the world. So we sent out for a couple of different genetic testings and got the results back. And I think I'm going to stumble over like maybe saying it exactly. So I'll share some clips of when we talked to the genetic counselor, because I'm still like, are you sure? But I mean, if I'm questioning the scientists that this is their expertise, like I'm imagining, yeah, I'm sure you guys are going to be like, at the same time. Okay, let's just jump right into it. So if for those of you who just want to get a quick and easy answer, I will answer that for you, so you don't have to sit and watch this whole video, because I know some of us are busy and we might want to just know a little bit of information that might be helpful for our lives. We got to keep moving. So we sent out for a cardiac genetic panel. So we were supposed to do this, oh my gosh, last year, but we were so like, we're just focusing on getting Cassidy to surgery and then recovering. Our minds weren't, it didn't matter. It didn't matter what Phillips' genetics were of, did he pass on this cardiac gene, therefore Cassidy had the same heart condition. So a little history is that our third daughter was born with AV canal, which is also known as AVSD or endocardial cushion defect. Pretty much there's a hole in the top of your heart, a hole in the bottom of your heart, and then the two sides are supposed to have a valve to itself. Well, it doesn't. It's just one big common valve, so it means all that tissue right in the middle that's supposed to be on both sides is just one big thing in the middle. And I'm actually impressed with how well cardiac babies do for a little while, and now they try to let the cardiac babies get bigger and just sustain as much as possible, and so that way the surgeon can be doing surgery on a little bit of a bigger kid. And so we made it to 4 months and 3 weeks before her surgery. Well, we sent out a cardiac panel, and I wish I had the paperwork in front of me, but I couldn't even probably tell you the gene anyways. It's like a bunch of letters and numbers and things that you wouldn't even recognize. But they are looking for like 50, that many genes that they were going to look at to see, is he a carrier of this cardiac gene that could be passed on. Sorry, trying to talk and do things at the same time. Makeup actually takes me not very long in the morning. I'm like pretty simple and basic. I put like a little base coat, maybe a little bit of a darker shadow in my crease, and just keep moving on. Little eyebrow. I used a pencil, but I feel like just staining it a little bit with this little eyebrow, what do you even call this? Gel, brow gel. It's like, partly it's easier, partly I feel like it looks more natural than a pencil because it's just like darkening the hairs that you already have. I used to not do my eyebrows at all, but I'm so pasty and light fair color that in pictures sometimes you're like, oh, just a little bit of color would do you justice. Okay, so seriously, doing two things at once is making me laugh. Okay, where is my concealer though? Okay, oh well, no concealer today. We'll just move straight on to, I use their little foundation. Right now I'm using 310, which is actually starting to get a little dark, so I might drop down to my 230 since it's getting winter and I haven't been outside much, so let's just go a little lighter today. Okay, so, sorry if you guys are just here for the results and I'm like trying to do two things at once and I'm showing you my makeup all at the same time. So dab in kind of some zones and then just dab it out so you're not kind of removing it, you're just kind of smoothing that. Okay, so they sent out for these cardiac genes and I was convinced, well, absolutely, like she has the same heart condition, obviously it's genetic. So I'm going to use their lightest bronzer. I'm going to use, ooh, not the mirror. I'm going to use Dune just because I'm more fair and just almost like just like dab it on. And anyone who took like art class, like treat your face like a little piece of art, like delicate and gentle, and like the more you push, it's not gonna blend as well. So just kind of be patient and delicate. Okay, so the result came back that Philip had one gene that they tested that came up that he has, like a little marker, but that gene is literally we don't have enough information about this gene. It's a possibility that maybe it could have some cardiac links. However, she said that usually if you're going to have that gene and have a cardiac aspect to it, you usually have it paired up with other genetic abnormalities with your limbs, and I'm forgetting a couple other things. I'll put in the clip right here.
So, as you know, we looked at a whole panel of genes that are all involved in congenital heart disease.
Sure.
And we identified one uncertain variant in a gene called SMAD6, SMAD6. And this particular gene actually has no well-established disease association. It's what we think of as a candidate gene or a preliminary evidence gene. So there's some evidence evidence supporting that variants in this gene would cause aortic valve disease and or some structural heart defects. However, they're typically found in patients who have other syndromic findings, meaning that there's, in this particular case, they've reported some bone abnormalities, either of the skull bones or of the lower arm. Or these patients typically have some level of intellectual concerns. And so...
What also makes sense?
A couple of things. One, this doesn't totally fit your presentation.
Right.
Two, the variant in and of itself is not very convincing that it's causing a problem. So these variants of uncertain significance are changes that we're not quite sure what they mean in the gene. So we're not sure if this is causing a atypical protein to be made or if this is just kind of individual variation and a variant that just hadn't been seen before. And so for kind of all of these reasons, the fact that the variant itself is uncertain and the fact that the gene is not well established yet, they don't recommend any additional family member testing because it won't change management or classification. I guess the way we can think about it is you already have a history of having one baby with a cardiac issue.
Right.
And so are you at a higher risk of having a second? Yes. Can we quantify that risk? No.
Okay.
I think at this point, I would maybe say it's up to 50%. You know, if one day in the future this SMAD6 variant is proven to be causative for what's going on, then maybe we would think, you know, okay, you have a 50% chance. But I think in the fact that we've ruled out a lot of genetic conditions, your risk is likely a lot lower than that.
And there was a couple other genetic findings that would have gone along with this gene marker that they think it's possible that this could carry some cardiac abnormality gene information. Does that make any sense? I know, it's a lot to take in. Okay. So I try to stick pretty high with my bronzer. I'm not really trying to like cut this like low. I almost use it a little bit more for just like the bottom half of my blush. I don't know. I'm not a makeup connoisseur. I'm just a throw on makeup to kind of have like some fun little art project on your face every once in a while. Let's do, so every day I've been doing Melon, which is really a pretty basic. It's like a basic light pink. Today I'll do Nectar, which is also a basic light pink, but it has a little bit of like an iridescent, like peachy color to it. So since it's getting fall, I'll add a little bit more orange instead of just basic pink. Okay, so talking to her, I feel like I was saying, but Cassidy has the same thing, so therefore obviously it's genetic. She says, as of right now, we will put your file in a flag if we get more information about that gene. But right now, we don't even want to test Cassidy because Philip could pass on that gene to Cassidy and she could have that same kind of gene makeup, like the makeup, the look of the gene would look the same on Cassidy. But that doesn't mean that that gene is saying absolutely it's a cardiac. It's not necessarily the information that your body uses to develop these cardiac anomalies. Am I making sense? I am trying as hard as I can, guys, because it's hard for me to even comprehend it. So literally, if you're ready to jump off this video, I'm literally telling you that they're saying, as of right now, you don't have a cardiac genetic marker that we would say, yes, you are passing down a cardiac anomaly. What? Yeah, so this is where I'm sure skeptics are going to say, Alex, you should know better. Of course it's genetic. But I'm talking to the geneticist counselor, the geneticist and the genetics counselor talk, and the genetics counselor talks to us and is telling us that, yes, like maybe we can look into it more. I was asking them, they're actually going to get us in contact with maybe the cardiac, like, genetic research side, so we can talk to them and say, do you want to look at our family link to see if maybe you can take in some more information, that maybe you can find a genetic link for, there's another marker that maybe is a genetic carrier for cardiac. But literally right now they're telling us you can keep having kids and the chances of you having a cardiac kid are, we don't know. Okay, I'm literally almost done with my makeup. Should I put a little bit of, like, let's pretend we're being a little fancy today. This is another old palette of eyeshadow. They just brought back eyeshadow on their website, I want to say within the last few weeks. And so a lot of the eyeshadows I use are discontinued, but they have like this new like liquid eyeshadow and some powder that you can go peek at if you are interested in kind of like a cleaner beauty option that that you're looking at. But I'm just going to, I was doing liquid for a while and I like it. I should have done this before I put on my face makeup, but oh well. Hopefully it won't fall too much. Okay, so I was talking to my girlfriend and I should do the liquid to show you how you shouldn't be afraid of liquid eyeliner. Can we not do that today, guys? Let's just not do that today. But my tip to her was, so when we put on a liquid and have that point, what I'm going to do is dab it, like, because she was saying, I just draw it and then it looks all crazy and I don't want to put liquid eyeliner on. What I tell her is you dab it, and when you're making your way into the middle, you're being more and more gentle on your hand, so you're making a skinnier and skinnier line. And then I go back out this way and I do one little angle that way, so it kind of has like a finish on that side. And same thing, I'll dab it, and dab it all the way till it's really skinny. And then if I need to go back and add some thicker, I'll dab a little bit higher. But then I'm not like trying to like wiggle my hand and make a really funky liquid eyeliner line. And then ideally, to cover up any mistakes that we all are gonna make with liquid eyeliner anyways, is to go in with a powder on top, and then you can kind of fix that. But for today, I don't want like a ton of makeup on, so I'm just gonna do, even this is like more than my everyday, but I'm just gonna dab some darker. This is a black, but you could do it just with a dark color. And just dab on a little bit, come into focus. Dab on just like a little bit of dark to just give a little bit more definition. So she was telling me if there is a marker of some genetic component that Philip could be passing on for a cardiac condition, she said it could go as high as a 50% pass down rate. And that would be saying we found a marker and you absolutely have it. Now, because there's a family link, she would say, okay, let's keep in mind that there could still be a genetic pass down the line genetic carrier. Like you could be carrying on a genetic cardiac condition, but as of right now, it's still very possible that it was a really random fluke. And I would also say with IVF, you have a higher chance of having a cardiac baby anyways, but the fact that they are the exact same condition still makes me think it's probably genetic, but we just don't have enough information about it. But I'm also hopeful that maybe it genuinely was just like a random fluke and we could keep having kids biologically that wouldn't have a cardiac condition, which is huge because we still have embryos and we will be using those embryos because to us, they are life, they were given life, and we are gonna give them the opportunity. Now, would we do another retrieval if we had another cardiac kid? Probably the answer is going to be no. But if we don't have a cardiac kid and we wanted to keep growing our family through IVF, would we ever do a retrieval again, is the big fat question. Okay, so after I do my eyeshadow, especially if I have liquid, I used to not love it because this is more natural makeup line, and so it's not going to stick like some of the more toxic makeup that I used to use that stays like until the next day. So a trick is to get their mattifying powder and just gently dust it over top of your liquid eyeliner or the powder, and it'll keep it from transferring to your upper lid, and it just keeps it on. And then I will just use the mattifying powder, same thing, like just a little bit under, and then, you know, just a little bit of the shine spots, but it makes it kind of set a little bit more, and it doesn't fall off your face as easy throughout the day. And I feel like it kind of does that final like seal of what some professional makeup will look like. And so almost like that setting spray, but right now I'm not wanting to spray kind of a chemical in my face that I'm going to breathe in. So the mattifying powder, I like to kind of set my makeup without doing that mist. Okay, all I'm going to do is some mascara. Okay, so this is kind of my go-to everyday makeup. Like, it's really, oh, hello. What I usually do, just because I think it's fun and I like shimmer, I will use their Halo highlighter and just go on the tops of my cheeks and even up here, just because I think that's fun. And then like if I'm getting really dolled up, like you can use your finger and like dab it on your nose if you want to be like really like defined. I just don't usually do that very often or ever. Okay, lipstick. Can we decide together? I've got, these are my go-to. This one I'm probably just gonna do. This is called Pearl. It's like clear, but it's lipstick, and I love the feeling going on versus like a chapstick. So I'll do that. I literally have a bunch of lipsticks down here, but these will probably be more of a go-to. So this is Garden Party. It's not as bright, or I dab it on. I don't do like rub it and then I will blot it off. But this dark one is Lip Intense. They like stick and stay. So if I don't want a bright lip, don't use a Lip Intense because this is gonna stay. Whereas like their other lipsticks in like this package, which I think now has upgraded to this package, this will like kind of rub off and then you put on new lipstick, like kind of a more of a normal one. So anyways, I usually stick to these because I'm not wanting something crazy going on, but this one's really fun. I used it the other day in the vlog, I think, maybe just a couple vlogs ago, and this is what I used and I really liked it. Okay, so that's that. I literally am telling you that I get questions all the time. Why would you have another kid? Like, you're gonna pass off this genetic condition down to your next kid. We literally got information from the geneticist that says, we don't know. We literally don't know if Philip is a carrier for cardiac genetics that are carried on, versus a lot of cardiac conditions are not genetic and they're just random. So many cardiac kids, it's just random and it just happens. And I'm sitting here, this is like the weirdest vlog where all I'm sitting here is rambling, saying, I don't know, I don't know, guys, I don't know. Like, I'm sitting here telling you, I don't know. I don't know. I'm gonna keep saying it, I don't know. It doesn't make sense to me that it wouldn't be genetic. It makes sense that there is a marker, that Philip has a gene that they're looking at. Literally, that's what it is. There's a gene that they're looking at to see, is it possible that this little gene setup is causing cardiac conditions, and this is where in the spot that is causing genetics to go down the line that cause cardiac conditions. Guys, I'm literally, that's, yeah. Can I tell you a trick that I'm not using right now? take a index card or some kind of piece of paper and put it over your lid and then do your mascara that way. Because every single time I do my makeup, every time, like even now I'm probably gonna do it, I will get mascara on the top and then I wipe it off, and all that makeup that I put on there, I literally am wiping it off with a Q-tip. But I'm gonna try really hard. See, I already got a little bit, and I'm just gonna wipe. This looks like it takes me a million years to do my makeup, but it really doesn't. This usually happens in just a couple minutes. Oh, this mascara is Beauty Counter's new mascara, because I used to tell you guys their old mascara was awful. I wanted to like it and I used it because I knew it was clean, but I used it like being like, okay, it's pretty much like a tint on my eyelashes. It didn't really put on a lot of product. This is their new one. Comes in this one. It's called, this is better, the Think Big All-in-One Mascara, and it does such a better job. And I have pretty thin eyelashes. They're long, but they're thin, so let's see. Can you see? So I think it does a pretty decent job. So for you that have been following me and you guys have already started Beauty Counter, I do think that this is so much better than the other mascara. So don't be afraid to spend money on this thinking, oh, it's gonna be like the other one. It's not like the other one. Okay, literally, this is where I'm ending. Oh, okay, lastly, if you made it to this part of the video, just put any kind of emoji that's a heart. There's a lot of different heart emojis that you can put down into the comments, because we have comments, and I'm just loving life since comments came back a few months ago. I just love it. Okay, but we also sent a genetic panel from the fertility clinic. So I sent a recessive gene carrier screen. It's called just a carrier screen to 2 years ago, 3 years ago, back when I was in California. And I came up with being a carrier of these 4 super random genetic conditions that I've never heard of. They all were compatible with life. There wasn't really any major things to them, so we just said, okay, that's nice, but we don't need to test Philip. Well, our new doctor said, well, you should just get Philip tested too. So we tested Philip, and his came back. He had 1 recessive carrier, and we aren't the same. So I have 4, I'm a carrier of 4 recessive genes. He's a carrier for 1. They're not the same. So a recessive like disease would be if we both were recessive and we both had the same one, the child could actually have a certain condition, not just be but because we don't have the same, our kiddos will not have these recessive genetic conditions that they look out for. So that's a lot of gene talk. And literally, I feel like this whole video, I just went around in circles saying, I don't know. But the information I do know is that as of right now, Philip's not a cardiac carrier. And there's no reason for them to test Cassidy. I'm not even kidding. So right now, I feel like a lot of people are going to want to feel like, but it has to be genetic. I know that feeling. I hear you. I feel you. I am in that same boat of like, wait, what? We will be moving forward with IVF, definitely getting screened through pregnancy, hoping that our embryo takes, and seeing and checking an in utero echo, which we would have done anyways because of Philip for any kid. But as of right now, we don't know if we are going to carry on any other cardiac babies. Isn't that crazy? Pretty crazy. So anywho, thank you guys so much for listening to me rant and helping me get ready today. And if you guys want to check out any of my more natural makeup that I use, I'll just leave a link in the description below. So you could definitely cake on this makeup a lot thicker if you want to. I just always do my makeup pretty light. But guys, yeah, that's all I have to say is we're moving forward, confident in our due diligence that we have gotten everything tested that we feel ought to be tested before moving forward with IVF. But I think for those of you who really made it to the end of this video, I'll share with you guys, is that we think we're deciding that it looks to be, when I start my cycle, it'll be a little too tight in that Thanksgiving mark and then right before Christmas, and it's just really tight. We have family, we have trips planned, and it just looks like a little bit too tight. So it looks like we'll have to wait like 2 cycles and then start in January. Granted, that would only be if Cassidy is weaned, and she seems to be slightly weaning herself. So we're feeding a little bit less, a little bit shorter. We've missed some morning feedings. We just go straight to breakfast, and she has fallen asleep in the car, so we've actually missed some snack feedings as well. So we're but today she wants to make up for it, and she's like pulling at my shirt and saying, no, I'm going to feed 3 times already before nap time because I want to. So that's where we're at. Thank you guys so much for watching this long, extensive video of me telling you we aren't genetic carriers of a cardiac condition. I still feel like I have to say it with a question mark, but thank you guys so much for watching, and I will see you guys in our next video. Go let your love multiply. Bye, guys.